Welcome back to part 3. In the first two parts of this presentation, we discuss how a good research idea is an observation or a problem that's restated as a question, and then how the question must meet specific criteria to be considered a good research question. And now we'll move on to how you further refine the research question to specify key details, including the population, the intervention or exposure, the comparator, and the outcome. Let's start with a scenario. In your TB clinic, only 50% of people who initiate treatment successfully complete treatment. So you develop your initial research questions around this problem or observation. Why do only 50% of TB patients successfully complete treatment? And what are our most successful services that help patients complete treatment? So first, think about what the patient or population is. Specifically, which patients or population are you interested in studying? In this scenario, are you talking about all TB patients in the country, region, or district? Are you talking about pulmonary or extrapulmonary TB patients? Are you talking about drug-susceptible or drug-resistant TB patients, or both? Depending on the population, it may make your question less interesting, less feasible, right, or more novel, right? So these things, specifying the population, really impacts whether or not it meets the finer criteria, in part based on what's previously known, and in part based on what patients you have access to, and whether it's feasible to carry out the research in that population. So next, let's think about the intervention, or in this case, the exposure. What are the potential barriers to accessing care? Are you talking about demographic characteristics of TB patients? Are you talking about financial, geographic, or health literacy of TB patients? What interventions or exposures are possibly related to successful linkages to care that are already going on in your context? The type of directly observed therapy. Is it provider or facility-based or community-based, for example? Is counseling provided in your context? Is any socioeconomic support, such as transport vouchers or food or nutritional support? Are any of these factors in play, and might they impact treatment success? So it's important to think about all of the various factors or exposures or interventions in your context that you might want to study, or that might sort of influence the treatment outcomes or the problem that you're seeing. So next, think about, is a comparison group needed? Is a comparison group needed to identify factors or risks associated with successful treatment completion? So some comparisons that you might think about are related to demographic or clinical characteristics, right? Are completion rates different in men or women, in HIV-infected or uninfected patients? Or it might be based on the interventions they've received in clinic. So for example, are completion rates different in patients who didn't receive counseling? And last, you really have to specify the outcome. Clear definitions of the outcome are essential, both so that people can understand what you're talking about, but also when you go on to sort of defining your measurements and how you're going to measure the outcome, you know what exactly you need to measure. So what do you mean by successfully complete treatment? It could mean take all required doses of TB treatment within 8 months. Or some people might mean that there should be a documented change in bacteriologic status in the last 2 months of treatment. Both of these involve different measures, and so it's really important to let people know how you're defining successfully completing treatment. So I'm going to go through a few examples of how the original question might be refined depending on the population, the exposure, the comparison, and outcome that you might be interested in. So for example, among patients initiating treatment for drug-susceptible pulmonary TB in the private sector clinics in Region X, what are the socioeconomic and geographic characteristics associated with patients who complete all required treatment doses within 8 months versus those who do not? So here, the population is patients initiating treatment for drug-susceptible pulmonary TB at private sector clinics in a specific region, right? So we use sort of 3 or 4 different descriptors to clarify what our study population is. In terms of the intervention or exposure, what we're interested in here is socioeconomic and geographic characteristics. In reality, some of these can be more clearly defined, right? But I think in the question stage, it's okay to be a little bit broad in some areas. And then in terms of the outcome, here we've defined successfully complete treatment as completing all required doses within 8 months. So here's another example. Among patients initiating treatment for drug-susceptible pulmonary TB at private sector clinics in Region X, are patients co-infected with HIV less likely to complete all required treatment doses within 8 months versus those who do not? right? So this question is establishing a comparison. It's the population is among patients who are initiating treatment for drug-susceptible pulmonary TB in private sector clinics, just like in the previous example. The exposure is HIV infection, and the comparison is those who are HIV infected or co-infected versus those who are not HIV and co-infected. And the outcome is, again, clearly defined and is the same as in the previous example. So again, this type of detail in the research question lets you know and lets others know exactly sort of what you're intending to study. Here's another example, and the last one that I'll go through. Among patients initiating treatment for drug-susceptible pulmonary TB at private sector clinics in Region X, are those who receive pre-treatment counseling by a trained counselor more likely to complete all required treatment doses within 8 months versus those who do not? So here, again, the population and the outcome are the same, and here we're talking about a specific intervention, right, instead of an exposure. And the intervention here is those who received counseling by a trained counselor pre-treatment. So again, we're clearly sort of specifying exactly what it is we intend to study. All right, so we come to the end of the talk. So to conclude, a clear statement of the research question is essential in developing a clinical research study. The question might arise from a problem or an observation that you've made, and it should meet the finer criteria, which again are feasible, interesting, novel, ethical, and relevant. You should spend time refining your research question. If the question is not good, your results won't be good either. So think about and specify the population, the intervention or exposure, the comparison if there is one, and the outcome that you intend to sort of focus on.